Hey guys, Woodruff here. I'm going to just be talking a little bit tonight about inflammation. So this is just an introduction. This is not going in depth because really as the nurse, you don't need to know that cell level stuff. There's lots of great medical videos about the cell level stuff, but I'm going to be focusing kind of on what you need to know as a nurse, and I'm just kind of giving you the basics. So let's start with inflammation and what is it? So effectively think of inflammation like a very trying to think of a nice word to say it, a very dramatic family member. This is someone who, like in your family, who, like, you tell them any news or anything happens, and then they are very upset, very worked up and overwhelmed. This is effectively what inflammation is. So anytime there's cell injury in the body, inflammation is usually started, and it's like a chain reaction. So it's almost like, when there's any sort of cell damage, then the body's like, oh my God. And then it like alerts, it turns on the alarm systems, and they're like, there's inflammation here, and starts to feel like there's this big fight or this war that's coming. And so it's trying to get prepared. So a lot of the inflammatory response or inflammatory reaction is the body preparing for a fight or war, or it's like, hey, we have to heal, we have to fix ourselves. So it's going into and not actual true fight or flight, but your immune system is like, it's time, it's our time to shine. So pretty much the body is doing a lot of things to prepare to heal itself and to repair any damage to the cell or the tissues, depending on, of course, what the damage was. But the body is trying to get all of its defenses together in order to prepare for this perceived, major problem. Sometimes it's kind of confusing. You hear infection, you hear inflammation, and it seems like they always go hand in hand. And the truth is that, of course, anytime you have an infection, you're going to have some sort of inflammation. But an important caveat to that is that just because there's inflammation doesn't mean there's infection. So you can have inflammation of tissues, you can have inflammation of your arm, your leg, some sort of minor injury, but it doesn't mean there's infection there. So same like with bronchitis, it might seem like, and maybe an infection was there at some point, but there's an inflammation present, but it doesn't necessarily mean that you're fighting an infection. And recognize with inflammation that the bigger the injury you have, the bigger the inflammatory response or reaction you're going to have. So, in other words, if there's major tissue damage, if you have a massive trauma, you're going to have a much bigger inflammatory response. It can become more systemic, whereas if it's just a local cut, bee sting, something like that, there's going to be less of an inflammatory or more local response. And know that inflammation is helpful. We actually need inflammation because inflammation kind of opens the doors and availability for all the things that we need to heal and get better. But it's not good to be inflamed all the time. So chronic inflammation can definitely lead to issues, and the inflammatory process can, like, again, it's kind of a dramatic family member, or if you don't have a very good family, a dramatic friend, that they mean well, but it gets a little too intense. So what causes inflammation? Pretty much anything. These are just a few examples, but I could go on and on. But allergies is an inflammatory response. Infection, like was mentioned, is an inflammatory response. If you get a burn, any sort of joint sprain or strain, so like local, like orthopedic injuries, more chronic stuff like arthritis. And there's also, like, of course, chronic inflammatory conditions like not irritable bowel, inflammatory bowel, even though irritable bowel is inflammation too. But yeah, and trauma is a big one as well. That any sort of trauma or injury to a tissue, joint, muscle area can cause inflammation. So this is as deep as I'm going to go on the cell level stuff. Effectively, what's happening on a cell level here that you need to know about as the nurse, because this is going to be kind of what you're going to see, is that there's a massive vasodilation. And, vasodilation serves a couple purposes. First, it opens the doors to allow, like the doors to, like, let me back up a little bit. When I'm talking about vasodilation, like in your capillaries, where everything is giving blood flow to your tissues, those like open up wide and allow for pretty much fluid to shift in to get more volume and more blood. And think like more nutrients to that tissue. But it also allows these fighters, your immune system to come in, all these helpful particles and mediators to get to the area of injury and like get the response they need in order to heal. But what you're going to see with that is you're going to see redness and swelling. So like, when you get like a cut or a bee sting and it gets really red and you're like, ouch, why is it red like this? Well, that's because there's really good blood flow there. And so while it may seem like, oh, this is not a good thing, it actually shows that you're getting the resources and things that you need to where you need them in order for it to heal. And it also gets swollen because, again, fluid is shifting as well with that vasodilation. Um, and then other thing that happens is that when cells are injured, mediators are released. So things like histamine is example of one. And these are really important because these mediators are kind of like really loud, annoying cells that tell the body what it needs. So it like some of them will help to get better blood flow and cause more vasodilation. Other ones will call for certain particles or parts of the immune system to come to the defense. But effectively, this is like kind of like when there's a code on the unit and we're trying to get all the resources together and get organized. This is what your body's doing during inflammation is it's trying to get together, get all the resources, make sure that it has the space, time, resources, and everything it needs in order to fight what it perceives as an attack on your body. So, as a nurse, sometimes there's inflammation that's inside. You can't see it, but often, this is why we need to do a good overall head to toe and a skin assessment because inflammation, we can see it on a, external tissue level. We're going to be looking for stuff that is warm, stuff that is swollen. It's painful usually to touch. It's going to be red. And remember, the warm, swollen, and red is all going to be from that vasodilation. And then sometimes there can even be a loss of function. Sometimes it gets so swollen that, like, let's say it was like something with my hand, it can get so swollen that I can't even move my fingers the way that I'm supposed to. Things like that. But all of this is a result of the inflammation that's happening. Again, the warm, swollen redness is going to be from that vasodilation. The painful can be sometimes it's the swelling can lead to compression of nerves, but some of those chemical mediators can also actually do damage to the nerves, which can lead to pain. Then, like I mentioned, the loss of function is going to be a result of sometimes that swelling that happens because of the fluid shifts when the inflammation cycle is started. So, big picture, what do I do as the nurse? So, there's acute inflammation and there's chronic inflammation. With acute inflammation, I'm really focused on healing because usually this is like a minor injury. When I say minor, it could be something more serious. But what I mean is it's not something that's going to be long term. The tissue just needs to heal. Whereas with chronic inflammation, my goal is going to be to prevent or slow down tissue damage over time. And if I can prevent them from starting that inflammatory cycle, then that would always be my goal. Commonly, these people are going to have fevers, especially if it's more systemic. So, of course, if they have a fever, I'm going to give them medications as ordered, and we'll talk about that on another slide. Hydration is important because when you have a fever, you tend to sweat and you can get dehydrated really quick. So, just make sure if you have patients with a fever that you're replacing what they're losing. And sometimes medications work to a certain extent, but we also need external cooling, whether that's ice packs, a cool bath, or cooling the room temperature in general. It's what's important. And something you'll find that's very hard is that the patient, one, either doesn't want to be cooled because the fever makes them feel like they're shivering and they want to get under lots and lots of blankets. But if someone's asking you for lots and lots of blankets, a lot of times that's your cue to say, hey, let me check their temperature. And then the other thing is sometimes, you have patients and their family are in the room and the family's like, I'm so cold. Can you turn it up in here? But you should be focused on the patient's care, even though it's hard sometimes. So then let's say that we have a soft tissue injury, then we're going to focus on what's called rice. And most people know this, especially if you grew up in the late 1900s, like I did, where we are talking about rice is rest, ice, compression, and elevation. And so the rest part of that is rest, especially let's say it's an extremity like a broken arm, they've had some sort of trauma. We shouldn't be out there, practicing our karate moves or getting too wild with those extremities or trying to walk on them too much. We really want to give them rest because the more that we use them, the more that it's imagine, when you were a kid and you would like build a beautiful block tower and some jerk kid would come over and knock your tower over. Like that's like what people are doing when they're not resting, when they have inflammation. Like your body's like, look, I'm making a masterpiece. I'm cleaning this up and making your tissue look great. And then you get up and you're like, I'm gonna walk. And then it's like, ah. So yeah, that's the best visual I can give you on that one. Ice. So it depends on, of course, what kind of injury you have. You can't apply ice to everywhere, but ice can be helpful. It helps to decrease that swelling and that inflammation. It can also really decrease pain as well. There's some stuff that shows that ice is really good the first few days, and then like heat or compression can help to, I'm sorry, not heat or compression, heat a couple days later can lead to help with getting like blood flow to the area. So usually they say ice first and then heat. But usually the I there is we talk about icing it early on. C is for compression. We do like compression. Compression helps to decrease some of that swelling from those fluid shifts that the patient may be having. And then elevation also decreases some of that swelling. And all of these things really help with comfort and decreasing people's pain. So that's a lot of times our goal too. Other drugs we might use are anti-inflammatories, which we'll talk about here in a minute. And those are not always used. It depends on the severity, location, where the inflammation is, what kind of, inflammation it is. But we may use some anti-inflammatories. And then if there's a wound or some sort of tissue, like external injury, as the nurse, I'm going to be managing, keeping it clean. And I'll do a separate video on wounds and wound healing and stuff like that. But I may be working on trying to keep things clean, dry, intact, and really watching the progression of their wounds, seeing if things are getting better or worse, and using like collaborative care, like with wound care and other things like we have like you'll once you start working in a hospital you'll see there's like endless wound care supplies, so like really learning like how can I help my patient, what kind of dressing do they need. You should have orders, but kind of learning how you can best take care of a wound is a very helpful in nursing practice. So there's different medications for inflammation. Of course, first, like we said, is we want to treat the symptoms like fever, and the most common ones are going to be stuff like acetaminophen. And remember with acetaminophen, we're always worried about, people with liver problems. So it's not safe to use these in people that have very severe liver dysfunction. But it can help and it treats fever and mild pain. And then there's ibuprofen, and ibuprofen really is kind of, and when it comes to inflammation, it's kind of a win-win in that it allows for decreased fever, but also treats inflammation more directly. So it can be helpful as a fever agent and an anti-inflammatory. So kind of killing two birds with one stone. But you'll see that we don't use ibuprofen as often in the hospital. It can kind of have like a blood thinning element to it. It's not a blood thinner, but it can have those kind of properties. So people that are at risk for bleeding, you're going to notice that we don't use it as often in the hospital. The other part is going to be treating the inflammation, so anti-inflammatory agents. The most common one you're going to see is steroids. And just keep in mind, the four S's that come with steroids is swelling. So they can have, almost like there's a lot of fluid shifts and stuff like that. So people sometimes can have like leg swelling, stuff like that with steroids. Remember, sugar, it causes hyperglycemia. So you're going to keep a close eye on their sugar, even if they're not diabetic. They may need to have their sugars watched, or they may need to receive insulin. They can have swings. And when I'm talking about swings, I'm talking about swings in blood pressure, like they can have hypertension. They can also have mood swings as well. And then stomach ache, that steroids are hard on the stomach. And same goes for ibuprofen. Usually you want to give both of these with food because it can lead to an upset to stomach. All right, so how do I know this patient's getting better or worse? So a patient with inflammation is getting better if they have decreased or no fever, they're having less pain, less or no drainage if there's a wound, or less or no swelling. Whereas they're getting worse if they have a new or worsening fever, worsening in their pain, they're having increased or new drainage, from that wound or area, and increased swelling or a loss of function. Like if they were doing okay for a while, but now they've lost function or ability to like move or utilize something, it can be a sign they're getting worse. And then the biggest thing as the nurse, that you might want to look out for, especially, is any sort of systemic sign of inflammation. So you're going to watch their vitals closely. Like usually, if you're on the floor in a hospital, you're going to be watching or doing what's called like a Muse score or looking at their vitals to see if they're showing any signs of SIRS, which is Systemic Inflammatory Response System. I have other videos about that, but you're mainly effectively going to be looking for, like increased respiratory rate, the fevers on there too. What do you call it? And the fever they can also be hypothermic depending on the patient. And then we're watching for hypotension as well. Those are going to be some of the big things that you're going to be looking for, or change in level of consciousness, especially in the older patients. Sometimes with when inflammation turns into infection, one of the first things you're going to see is confusion or change in their mental status. So just kind of keeping an eye on that. Yep, so that is inflammation, just quick down and dirty. I hope something here helped you. And yeah, I'll see you for the next one. Bye.